Hello and welcome to CHD Wise, an education series for patients and families. My name is Becca Kalivas and I am the Education Director at Conquering CHD. This event is being recorded live and the recording will be stored at conqueringchd.org. In today's episode, we welcome panelists from Nemours Children's Health as we explore helping your child cope with their CHD. Everything from clinic visits to procedures and hospital stays. Our moderator tonight is Dr. Pete Weirden. He joined Nemours Children's Health in October of 2015. Before joining Nemours, he served as a pediatric cardiothoracic surgeon at the Children's Hospital of Pittsburgh of University of Pittsburgh Medical Center. Dr. Weirden earned his medical degree and doctorate in pharmacology and toxicology from the West Virginia University School of Medicine, where he continued his training with a residency in surgery. Following his residency, Dr. Weirden completed a fellowship in pediatric cardiothoracic surgery at the Hospital for Sick Children in Toronto. Dr. Weirden is certified by the American Board of Thoracic Surgery and the American Board of Surgery. Dr. Weirden is recognized as an international authority on the development and implementation of artificial hearts and lungs in children. He also serves as an active member of the Conquering CHD Scientific Advisory Committee. Our expert, who Dr. Weirden will introduce momentarily, is Child Life Specialist Jenna Reed. Welcome everyone and thank you for joining us. Before I turn things over to Dr. Weirden, a few housekeeping notes. Following the presentation, we will be answering questions submitted using the Q&A function at the bottom of your screen. If we do not cover your questions during that time, or if you have follow-up questions to a topic being discussed, we will make note of those questions asked and follow up as possible after the webinar. As always, with the information learned, we encourage patients and families to discuss their specific concerns directly with their care team. With that, I will hand it off to Dr. Weirden.
Good evening. Thank you, Becca, for that introduction, and I'd like to welcome everybody to CHD Wise. As Becca said, I'm a pediatric congenital heart surgeon, and I joined Nemours Children's Health in 2015. Nemours Children's Health is one of the largest pediatric healthcare providers in the country. We operate in 5 states. We've had a long-standing hospital in Delaware, and in 2012, we opened a new state-of-the-art hospital in Orlando. And we performed our first heart surgery in June of 2016. And since that time, we've done hundreds of heart surgeries and have grown to over 30 providers. This last month, we unveiled a new logo and a new motto that we aspire to care for children well beyond medicine. And I think Jenna will show you that tonight. We're also very proud of our partnership with Conquering Congenital Heart Disease. We have been working together and we've been able to serve patients and families on a local and national level since 2018. And we are honored to support Conquering Congenital Heart Disease patient advocacy efforts and all that they do for patients and families across the country. Myself and Dr. Erica Sood, who is one of our providers in Delaware, have been involved personally with the organization by serving on their scientific advisory board. And this provides us with an opportunity to work to inform research activities and educational resources. And now I'd like to introduce somebody that's indispensable in our care of the children, and that's Jenna Reed. Jenna is a certified child life specialist who earned her Master's of Science degree in child development. She has been with Nemours Children's Health since 2017, working in the cardiac unit since 2018. Jenna is also an adjunct instructor at the University of Central Florida and the College of Community Education and Innovation, teaching future child life specialists how to assess and support the psychosocial needs of children in hospitals. Her favorite part about being a child life specialist is meeting a child who thinks they can't and helping them get to a place where they can and say I can and say I did it, and then celebrating that victory together. So thank you, Jenna, for being here and doing this for us tonight.
Thank you for that introduction, Dr. Weirden, and thank you, CHD Wise, for having me here. It's an honor to present to all of you tonight and help your kids cope better with their CHD. So first of all, welcome, parents. You are your child's advocate. You are their safest and most trusted person. And most importantly, you know them best. You have known them their whole life. You know their favorite things and their least favorite things. So we rely on you as their healthcare team to tell us how we can help them best when they're at the hospital. You are going to play a huge role in preparing them for their hospital interventions, more so than their child life specialists even will. So the first step in that is being prepared yourself. You can do this by asking your surgeon or your physician as many questions as you need so that you can understand your child's condition fully, and then you can help translate that language of the hospital into words that your child can understand using developmentally appropriate language. Next slide. So diving into appropriate language a little bit, we're going to talk a little bit about ambiguous language that's used in the hospital a lot, how your kids might interpret that, and ways that we can be a little bit clearer. And this is language that your healthcare staff might just use because it's, you know, it's our jargon, it's our lingo that we use. We might not think about it a lot, and you might have to translate it at the bedside for them. It's something that as adults we use a lot and we don't think twice about. But as kids, these are words that they haven't really heard before. This might be the first time that they have heard it, and they might interpret it a little differently, and it might scare them a little bit. So some things that they might hear at the hospital, they might hear prior to their cardiac surgery that they're going to be put to sleep. And a lot of kids, when they hear that, they align that with the fact that maybe a pet at home was put to sleep, and then that pet never came home after going to the vet to be put to sleep. So they're going to associate that being put to sleep with not coming home or not waking up afterwards. So we want to clarify that for them, that when they have surgery, they're not going to be put to sleep like a pet was, that they're going to be given sleepy medicine, that there's a beginning, a middle, and an end to that, and that they're going to wake up after it's done. You know, they might hear that, you know, for their cardiac MRI, they're going to have some dye during that, they're going to have some contrast during that. And when they hear the word dye, they just associate that with, you know, the big D word that they have heard their whole life. Is that going to make me die? So again, just, you know, clarifying for them, we're giving you medicine that's going to help us see your pictures better. I like to use the analogy of, you know, this medicine is kind of like highlighter for inside your body. It helps light up your pictures so that we can see your pictures better on our camera. Stretcher, you know, we're going to transport you down the hallway on a stretcher. Younger kids especially are going to hear the two syllables in that, stretch her. Why are you going to stretch me? That doesn't make sense. So instead, just, you know, simplifying things. It's a bed on wheels. Flushing your IV, you know, instead just breaking that down, we're putting water through your IV to clean it out, to make sure that it's working. You know, they hear the word flush and they immediately think of going to the bathroom and using the toilet. So again, that one's not as scary, but it's just something that is going to create a misconception. Next slide. So, you know, alongside not using ambiguous language, we also don't want to use language that's too hard or too threatening with children. We want to be honest with kids always. We want to come from a place of trust. We want to say what we mean and mean what we say when we're preparing them for difficult things. But we want to be as soft as we can, because at the end of the day, they're still kids. So with that being said, if something is going to be painful, if they're going to experience discomfort, we want to prepare them for that, but we don't have to say this part's going to hurt, because then that's something that it's going to be really hard for them to get through, and they're going to fear that a lot and have some difficulty in approaching that. So you can prepare them for exactly what the sensation of that is going to be instead. You know, some kids in the hospital have experienced an IV and they've said that it feels like a pinch or a poke, or when the contrast goes in for the MRI, they said that it feels warm or cold or whatever the sensation is instead of just telling them this is the uncomfortable part coming up, this is the cold part coming up, this is the pinch part coming up. You know, during your surgery, we don't want to use really harsh language like we're going to cut here, we're going to open you up, we're going to slice, we're going to make a hole. We want to use softer language like this is where the doctor is going to make a small opening to fix your heart. When you wake up, that opening is going to be closed. with string band-aids, that next one there, because sutures and stitches, that's just not a word that a lot of children have heard before. Stitches, maybe, you know, if they've fallen and had to go to the emergency room to get stitches for a laceration of some sort, they might have heard that one before, but a lot of younger kids especially haven't heard that and can't conceptualize that. But string band-aids, I mean, that's a really great way just to explain exactly what it is. They're band-aids that look like strings, right? And they close a small opening and heal it and make it feel better. And then hold down, you know, that's a hard one when we talk about some of these procedures that have to happen at the hospital. We sometimes have to help kids hold still, right? Because we need to keep them safe to get procedures done. But we don't want to be threatening and say, we're going to hold you down now because you're not cooperating. Instead, we can say to them, you know, you're having a hard time holding still, so I'm going to sit with you on the bed and I'm going to remind your body to hold still. Next slide. So moving away from language, now that we've kind of covered the basics of that, we can talk a little bit about some of the different things at the hospital that you might approach and you might have to go through, and ways that you can prepare your kids for those things. So they're going to have to go to the clinic a lot, right? And coming to the clinic does not have to be scary. Coming to the doctor does not have to be scary, especially for kids with CHD. It's something that they're going to have to do a lot and they're going to have to get used to. So we might as well make it something that we can normalize, right? So we can give them choices about things that they can bring with them to make that experience more normal and more comfortable. So what do they want to bring with them from home to be a helpful distraction during that appointment when they don't have to be actively involved? Do they want to bring any small toys, their iPad, if they're old enough, books, coloring sheets, or anything like that? Anything to help normalize what they would be doing if they were at home in their normal routine during that time. And then if they do have to have any tests while they're at the clinic, you can repurpose those same things that you brought from home to utilize as distraction during their exam. And remember, like I said earlier, you're your child's greatest support and you know them best. So remember to advocate for them while you're in the clinic, for what they need, what you've brought with them to utilize for that distraction, and allow them to make choices when choices are appropriate. If there's a choice to be made, we want to try and give them as much control as we can, because they weren't able to make the choice to have CHD. They weren't able to make the choice to come to the clinic or to have different procedures. So if we can give them the choice to sit in the chair in the room versus to sit on the exam table, if we can give them the choice to listen to music versus to play a game on the iPad, those are all choices that are going to promote their control while they're at the hospital and make them feel like they have an active role in being there. Next slide. So an echocardiogram is something that might happen in the clinic a lot. This is usually referred to as an echo or sometimes a cardiac ultrasound. And basically it just creates pictures of the heart. It's a painless ultrasound test. It shows the structure of the heart and how well it's working. It's typically done while your child is laying down. It takes 30 to 60 minutes, depending on how many pictures they have to get. Sometimes stickers are placed on the chest that measure the rhythm of the heart while it's beating, and then a gel is placed on the chest that helps kind of move the sound waves around and travel from the electrocardiogram wand to the heart and back again, and that's how they capture the pictures. So a little tip for this is that you can always stay with your child during this exam, and you can help keep them calm by either holding their hand during the exam, sitting right next to them at the head of the bed if they're laying down, reading to them, showing them their favorite video if you have a tablet or a phone, and giving them those choices of what they want to do during it. Next slide. So when you're preparing for an echo, if this is the first time they're having it done, this is something that you could say, and this is exactly how I would prepare them as their child life specialist. We're going to take a picture of your heart today. We're going to use a special camera and some jelly to take some pictures. The camera will touch and move around your chest, but it will not hurt. Your job is to hold as still as a statue during the test so that your pictures aren't blurry. I will be with you during the test and you can watch your favorite show until it's over. What do you want to do during your echo? Next slide. So next is an EKG, or sometimes an electrocardiogram or an ECG. It kind of depends on what hospital you're at, what they call it. But electro refers to the heart's natural electrical activity. And this is a little different from an echo. It's very, very fast. And it's really just measured through the small wires that are taped to your child's chest. And again, you can give them the choice of what they want to do during their EKG. It's a very quick test. Honestly, it takes longer to place all of the stickers across their chest and their legs and their arms than it is to do the actual test. Next slide. So you can kind of see on the picture here what the setup is. But another way to prepare them, very similar to the echo, you're going to do a test to see how your heart is beating. They're going to put some stickers on your arms, legs, and chest. Then the wires will be placed on their stickers, but don't worry, those wires don't hurt. They just send a picture to the computer of how your heart is beating. And once the computer has it, we can take the wires and stickers off. The stickers come off pretty easy and won't hurt. But if they do, you can let us know. I can be with you during the test and we can watch TV or read together until it's over. And your job is to help us make sure we have all the stickers where they need to be and to leave them on until we get our picture. What do you want to do during the EKG? I also find that it's really helpful during procedures, especially when you have a preschool or a school-ager child, to give them a job, give them a role. So during a procedure, it's their job to stay still. It's their job to make sure the stickers stay where they need to stay. It's their job to count to 10, to watch their video, to sing the ABCs. Give them a job so that at the end of it, you can say, you did such a good job doing this. And then they have a sense of accomplishment, a sense of mastery, completing that procedure, something to celebrate. Next slide. So a Holter monitor. This is something that after a clinic visit, you might get sent home with for further monitoring. It's a small wearable device that tracks your child's heart rhythm. They might wear it for 1 to 2 days and it records all of their heartbeats and events. It might be done if a traditional electrocardiogram doesn't give your doctor enough information. And it might help us to understand if they have a heart rhythm problem as well. So something fun that you can do if you are sent home with a Holter monitor to give a little bit of that control back, a little bit of that choice back, decorate it. Usually it's sent home in like a little bit of a bag that kind of hangs around their neck. You can put some stickers on it. You can put some foamies on it or tie some tassels or some ribbons. Any way to promote their control over the device and this thing that they have to be attached to for the next 24 to 48 hours. They might as well have some fun with it and kind of desensitize that medical equipment. Next slide. So there's an example there on the picture of what it looks like. Preparing them for this test, you're going to get a small camera that you get to wear that will record your heartbeats, just like your EKG did. You get to wear this camera around your neck for 1 to 2 days. The camera will use stickers on your chest, similar to your EKG, to take pictures while you do all of the same things that you like to do while you wear it. And that part is important because they're going to wonder, am I allowed to do the things that I like to do while I have this, because it's such a long test. So you can say like play with your friends, go to school, play in the house, play on your computer, do all of the different things that they like to do. They can still do those same things. They can still be themselves during this test. The only thing that you usually have to skip is taking a bath so that the device doesn't get wet. And they might be okay with that. Next slide. So preparing for a stress test. A stress test it usually shows how the heart works during physical activity. So this is something that might be ordered if we're concerned about how the heart is going to react to exercise. And if exercise makes the heart pump harder and faster, the stress can reveal problems with blood flow in the heart specifically. So this test usually involves walking on a treadmill or riding a stationary bike of some sort while your child's heart rhythm and blood pressure and breathing are all monitored. And will take place in the clinic. So this usually takes about an hour, including all of the prep time and the test time. So again, allowing them to make a choice about what they want to watch or listen to during the stress test, and promoting their control during that medical experience. Next slide. So for preparing them for this, you can say we're going to do a test to see how your heart beats while you're exercising, or while you're running or riding a bike, whatever the test exactly entails, because they might ask. They will put some stickers on your chest, and then wires will be placed on those stickers. Don't worry, they don't hurt. So similar to that EKG. You might also have to wear a special sleeve on your arm that gives your arm a tight hug, so that blood pressure, depending on how old they are, you can help explain that this way. This lets us know how your blood is pumping. Your job will be to walk on a treadmill or ride a bike, just like at home. I can be with you during this test, and we can do any of the things that you like to do while you're exercising to keep you busy and distracted. Next slide. So blood draw. I know this is one thing that a lot of parents are always really concerned about. But we can learn so much about how a child's heart is functioning and what their levels are just from a vial or two of blood. And most times you can always stay with your child during a blood draw, and it only takes a couple of minutes. It's usually faster as well if the child stays still. So increasing their cooperation is vital during this. You can always help your child cope best by giving them choices during this, preparing them for all of the sensations that they're going to experience during this, and helping distract them if they're the type of kid that is going to want to look away. Another big thing is encouraging them to take deep breaths during a blood draw or an IV. So if you have a child who doesn't really know how to engage in deep breathing yet, if they're a little too young, another really good analogy for this is blowing out birthday candles. Most kids have done that at some point. So we're going to pretend like we're blowing out birthday candles. We're going to take in a big deep breath, and then we're going to blow it out. Or we're going to breathe in like we're smelling flowers, and then we're going to blow out the birthday candles. And then that should work really well for that and getting them to take deep breaths so that their veins are cooperating during the blood draw. Next slide. So preparing them for a needle poke for a blood draw. We need to put a small straw in one of your blue lines so we can take just a little bit of blood to learn about your body. Your blood helps tell a story about your body, so this will tell us what we need to know to help you in your heart. You will feel a quick poke when we put the straw in, but it is important to hold as still as a statue. You can hold my hand, and we can do whatever you want to do until it's over. You can also sit in my lap, and I can give you a big hug during it. So you will see to the right here, this is called Buzzy. He is a fabulous pain management tool that we utilize at Nemours Children's Hospital, Florida. And you can order one if you want. If you go to buzzyhelps.com, I don't know if you can see this on my screen here. There he is. Buzzyhelps.com. You can order one, but he is based off of gate control theory, where he actually tricks the brain into not feeling pain below Buzzy. So what you do is you press the button on the top and he buzzes, and you'd put him at the site of the poke, and he tricks the nerve endings all the way up to the brain into not feeling the pain below where he's located. He also comes with some little ice wings, which are really cute and slide into the little section on the back so that he can numb the skin right below where he's placed. He's amazing. We use him all the time. He's also really cute and really fun and friendly for kids. I highly recommend him if you have a kid who's going to be having a lot of blood draws for INR or whatever in the clinic for CHD. And then when you're explaining IVs, a lot of kids don't really realize that and the difference between an IV and a blood draw is that when the IV is placed, it really is just a little straw. I have an example here. Hopefully you can see it. It's just a little straw rather than the needle that stays under their skin and inside their blue line, inside their vein. So that really is a good thing to help them not be so afraid of having these tests and having blood drawn via an IV, to conceptualize that it's not a needle that stays in their skin, that it's just a little straw. Next slide. And then here we have a kind of quick reference for comfort holds. This is what I was talking about, where I was saying that your child can actually sit on your lap during a blood draw. If you go into a clinic and you advocate for, I think my child would do best if they sat in my lap during this, and you get them into one of these positions. Most times your staff will work with you and try to do the lab draw in the way that's going to work best for you, because we want to make sure that we're providing atraumatic care and that your child is coping and that we are getting this done in the fastest and best way possible for you and your child. So these are a couple of great ways that you can be empowered and involved during a procedure, during a blood draw or an IV start, and ways that you can comfort your child and keep them safe as well. This is a handout that you'll get as well. Next slide. So preparing for IV starts, very similar to blood draws. The only difference there is, like I said, it's that flexible tube, it's that flexible straw. So it's placed inside the vein, usually in the hand or the arm. We'll use these IV lines to give people medicine and fluids, obviously, while they're hospitalized. It only takes a few minutes and is fastest when the child is calm and able to stay still. So give choices for distraction if they're the type of kid that likes to look away. Some kids are active copers and they're going to want to watch everything that's happening to their body, and that's okay. We can advocate for that as well and help them process and cope with that. But giving them a job during that IV. So your job during this is to stay still, to sit on mom's lap, to hold their teddy bear and squeeze really tight, to play a game on the iPad, to count to 10, whatever that job is, because that's going to promote their industry. It's going to promote their accomplishment once they've done it and they've done it well. It's also going to give them something to focus on. And then when it's over, you can tell them how well they did. Next slide. So preparing them for IVs versus the lab draw, very, very similar. Only difference again is that we're using that small straw in one of your blue lines so that we can give your body a drink and any medicine it needs while you're at the hospital. A lot of times they'll use the IV to draw blood from at the hospital too. So you can add that in there depending on what your situation is. You will feel a quick poke when we put the straw in, but it's important to hold as still as a statue. You can hold my hand and we can watch your favorite video, sing a song until it's over. You can also sit in my lap and I can give you a big hug during it. You'll see here, we have a teddy bear with an IV in his arm. This is a perfect way to prepare your child for something. Use something that they love at home to engage them in the educational process. You might not have an IV at home, but there's lots of other things that you can kind of get creative and come up with to prepare them. Something that they're gonna experience a lot at the hospital are masks, right? So we can practice putting a mask on our teddy bear. I don't know, my background is preventing this from happening a little bit, but I have some stickers here, and all I did was I took some jewelry thread and put it under the stickers, and I made a little EKG demonstration. And then I have my little IV kit right here on the teddy. And this is a really good way to prepare a kid for what they're going to experience in the clinic, using Teddy at home, and then they get to be the doctor and they get to do all of the things. Next slide. So preparing for a catheterization. This is a procedure that a lot of kids will have, and it can determine a lot of different things. It looks at the heart and the blood vessels. It figures out how things are formed and connected. It can check the pressure and the oxygen level. It can be used to even treat congenital heart defects or irregular heartbeats. It can open narrowed blood vessels and repair leaky or narrow heart valves. Next. Now, preparing for this, you'd prepare very similar to having a surgery of some sort, because it is something that's going to happen while they're asleep. You'll just really want to focus on the reason why they're having the cath. For a lot of kids, when they're going to sleep and they're having some sort of sedative procedure, they just want to know a little bit about what's going to happen while they're asleep, but they don't need all the big details. They just want to know why they have to go to sleep and why this procedure is happening to them. So you're going to have a procedure while you're asleep that's going to help us learn about your heart, fix your heart because it's either beating too fast, too slow, has a hole, etc. You can leave it at that. You don't have to go into the details that the catheter is placed through this vein and goes up to the heart and does all of this. I mean, unless they're 16 or 17 years old and they want all of the details, then they can be actively engaged in that conversation in the clinic with the physician and surgeon and learning about all of that. The doctor will give you sleeping medicine that will keep you asleep the whole time during this procedure, so you won't feel anything. And that's the important thing to focus on. When you wake up, remember that beginning, middle, and end, the procedure will be done and you will have a Band-Aid on your upper leg and you'll have to rest and lay down for several hours. I'll be with you as soon as you wake up. And then there are some resources out there that you can find that are some storybooks about actually having a heart cath. One that I have at Nemours is called Maddie's Heart Cath. You can find this on Amazon, I believe, but it's a little preparation coloring book that talks all about going to the hospital and having a catheterization. There's another one called Nathan's Special Heart. I don't have an example of that one, but it's another really good one about having atrial septal defect repaired in a cath lab. Next. And then moving on to cardiac surgeries. Depending on the problem, doctors can patch a hole in the heart, fix a valve, rebuild or repair a blood vessel, or stretch open a blood vessel that's too narrow. There's so many different reasons that your child might have a cardiac surgery or need a surgery, and tons of things that can be repaired in the cardiac OR. Next. So again, keeping it very similar to how you prepare them for the cath, focusing on going to sleep, not feeling anything, and the reason why they're having that surgery, and a simple explanation of what's being fixed. So you're going to have surgery while you're asleep to fix your heart because you were born with this defect. That means that you were born, your heart was a little different than it was supposed to be. It's not anything that they did wrong. And explaining lots of kids are born with heart defects and lots of kids get them fixed just like you. So letting them know that they're not alone. The doctor will give them sleeping medicine. They'll sleep the whole time. Very similar to the cath again. But the important difference with this is that when they wake up from a cardiac surgery, there's going to be a lot of stuff attached to their body that they will probably want to be prepared for. They might wake up with a catheter, they might wake up with chest tubes, they might wake up with pacer wires, all of these different things attached to their body doing very important jobs. So just a quick way to explain that and the sensations of that is that there's going to be some extra tubes on your body that weren't there before, but they're all there to do important jobs. They're not there to hurt you. They're just there to help extra fluid drain from your body, extra water drain from your body, make sure that your heart is working the way that it's supposed to after your surgery, and they won't stay there forever. They're just there until we know everything is working and everything is good to go, and then we can take them away. Next. So there's a couple of resources out there as well preparing for cardiac surgeries, depending on what surgery your child is having. Ones that I use a lot that are pretty generic though, that I'll give to most kids. Zipline is a really good one. This one's on Amazon and I think Barnes and Noble as well. But sorry, I'm trying to like balance it right in front of my body so that you can see it instead of the background. But it's all about having a sternal scar from having an open heart surgery. And how this little girl has her zip line and she's very proud of it, and how she uses the term zip line to explain having had heart surgery to all of her friends and how it's something that makes her brave, even though it makes her different. Charlie the Courageous is another one. You can find this one on Amazon and Barnes and Noble as well. It's another one about a little baby that was born blue with CHD, later gets her heart repaired, realizes she's a little different from her siblings, but that doesn't mean it's a bad thing, and how she just, goes throughout her life with CHD. This is a comic book, Understanding Congenital Heart Defects. This one's really good for older school agers and teens. This one is actually from childsplaycharity.org. And we had these donated to our hospital, but I think if you went to childsplaycharity.org, you might be able to find copies of them. And then the last one is The Beat Goes On, which is a guide for teens all about pacemakers and ICDs, which is amazing. Absolutely amazing. I love it. Next slide. So now just moving generally into preparing for hospitalization, I've preached it throughout this whole presentation, but control is key. Normalization is key. Very, very simple things that you can do. Bring items from home that are going to keep them comfortable. Some of their favorite things, their favorite stuffed animal, their favorite toy, blanket, phone chargers for that tablet that's going to keep them entertained, any very special toy that they play with every single day. If they're teenagers, if they're older, things that are going to help them stay connected to their friends, to their siblings, so that they aren't feeling like they're missing out. And your hospital, they might have a child life team. If they do, use them. We are here for you guys. We are here to help with these hard conversations, to help provide the language that you need and help provide all of the tools that you need during your clinic appointments, during your inpatient hospitalizations, to make sure that your child is coping, that you are coping, and that everybody is as supported as they possibly can be through all of this. Next slide. So, last but not least, I think the biggest piece of advice that I can give to you is just meet your child where they're at. I think the best thing you can do is be honest, be simple, and be soft. And just, they're going to come to you with questions when they're ready. If you tell them this is something that you were diagnosed with and we have to have this procedure and stay at the hospital and, all of these different things that we have to do, you keep it simple, you keep it soft, you keep it brief. And if they have questions, they're going to come to you and they're going to ask them when they're ready. And if they don't, that's okay too. As long as they know what's happening to their body, they know what to expect and they're prepared, you have done your job. And if you don't know the answer to some of the questions that they're asking, that's okay. You guys can write it down together, and at your pre-op appointment, at your next clinic visit, you guys can bring that notepad, those questions you wrote down together as a team, and you can ask your physician and your surgeon together, because you and your child, that's what you are. You're a team. And your physician and your surgeon, they're joining that team. Next slide. So there are a couple of handouts that I've provided. There's that comfort holds quick reference that just kind of walked through all of the different things that you can do, those comfort holds that you can employ when you're at a clinic appointment or in the hospital with your child and you want to help support them during a procedure. There's also a developmental handout called A Guide for the Caregiver of the Hospitalized Child. It just goes by developmental stage, ways to support a child in the hospital, things that you can expect at developmental ages, ways that they might regress, ways that you can support them, different interventions that you can provide for any caregiver, not just healthcare staff, parents as well. So I think that is all I had, and we can open it up to questions.
Thank you, Jenna. That was fantastic and comprehensive. A lot of helpful suggestions. Of course, none of that surprises me at all. You guys do such a remarkable job with the patients every day. Jump right into the questions. We have one on the chat. Do you have any suggestions for providers in a clinic who may not have a child life available? And then the second part of that, any recommendations for speaking with parents versus their young primary students or K-8 students? So if there's no child life, then the parents and the child frequently aren't separated, I think is what the question is. And how can you handle that situation when you have to impart information to the parents, but you also have children present where there might not be as robust child life as we have at our hospital?
Sure, yeah. So, I think for the first part of that question, you know, if you don't have child life at your hospital, that's okay. You know, some of these resources, like I said, you can find on Barnes and Noble, you can find on Amazon, you can go to buzzyhelps.com, you can order buzzies for your clinic, for your outpatient center. These are all things that you can have access to help support your patients in your center. And I mean, some of these, I think when you have to have some of those difficult conversations with parents and with patients, and you don't have child life available to help communicate those things and break down some of that language for patients, or take the patient out of the room, which might be maybe what you're asking more about. I think just asking the parents, is this a conversation that you want to have as a team together? Is this something that you want to have separately and you want to discuss more with them at home? Because like I said, you know, parents, they know their kids best, and they might be able to tell you right there in the moment, like, nope, they're ready to have this conversation. We can do it all together as a team. Or, you know, I actually don't think that this is best. Like, let's find a time that we can talk one-on-one when I don't have my child here with me, or let's figure out a different way to do this. But I mean, there's lots of resources out there in providing atraumatic care if you don't have child life at your hospital or at your center. So that's something that I implore you to look into. But I hope that this was helpful in at least getting you out on the right foot.
Thank you. I've kind of follow-up question to that I deal with from time to time, and I agree 100% with you that parents know their kids best, and I'm always very deferential to their thoughts. But sometimes I also think we don't recognize how amazingly resilient that the kids that we care for are, and what's going on in their heads. And so I frequently like to talk to them, ask them if they have any questions, and many parents feel like they're just not imparting any information. You know, it's just overwhelming to their child. And so I guess the question is kind of two parts. One is sort of the age range. Like, I don't know, for a 16-year-old not to really hear it is the right thing to do. So your thoughts on that? And then secondly, maybe words of encouragement that I could give to parents that, you know, the capacity, don't underestimate the capacity of these kids we care for. They'll never cease to amaze you.
Oh, for sure. I mean, I think, you know, it's something that I said throughout the presentation tonight, but I mean, number one is being honest with kids, right? We're their most trusted people as their parents. We're their most trusted people as their healthcare providers. We're caring for them and their bodies. And it's important to maintain that trust, right? We don't want to lose that as parents. We don't want to lose that as healthcare staff. So I think being as truthful but as soft as we can and having these difficult conversations is crucial. It's vital, because at the end of the day, they probably know something's wrong. They know something's happening in their body. They know something's not right. So if we don't involve them, invite them into these conversations, they're in their heads alone, not knowing what's going on, right? So it's better to give them some information than nothing at all and have them alone on an island, right? And when they're ready to be more involved in the conversation and to ask some of those hard questions, then we can be there for that. But sometimes it's just as easy as, you know, there's something different about your heart than the typical person, than your mom or your dad or your brother or sister. And we are coming to this hospital or to this center to figure out what it is. We're going to do some tests and we're going to figure out how to fix it, right? You don't always have to go into the hard details, into the scary logistics of everything, but it's important to at least let them know what's going on and what the plan is, because they know deep down something's going on.
Yeah, they're just really amazing. It's a funny anecdote, but it was a little girl. She was 8 or 9, and I asked her if she had any questions, and she was a huge Michael Jackson fan, and she said, "You're not going to give me propofol, are you?" So we have a question from Instagram. How do we help lessen the load of those times that you can't stay in the child has to stay in the hospital, but we can't be with them 24/7?
Yeah. Oh, that happens so often. especially with our CHD kids, they might be hospitalized for weeks, months sometimes. That's really, really difficult. I think it's important to stay as connected as we can with our kids at the hospital, and maintaining that connection, even though we might not be able to be there every day. So if it's a child that has a routine at home, trying to impart that same routine in the hospital. So if they have a routine, if they have a schedule at home, maybe we can make that same schedule at the hospital. Wake up time is this time, brushing our teeth, eating breakfast, working on schoolwork, playing games, whatever it is, writing it on the whiteboard, writing it on a cardstock, decorating it, hanging it up in the room, so that they are maintaining some sort of routine while they're at the hospital, even though you might not be there. That way their whole healthcare staff, their nurses, they can follow that too. Another way you can on that same schedule FaceTime, phone calls or texting time, whatever you want to do with family members, so that they can stay connected, even though you might not be able to be there every day. Texting time with brother, phone call with brother, so that they have those opportunities to stay connected with their family as well. And then sending things from home too. So if brothers and sisters can't visit the hospital, especially right now with COVID, we're dealing with that a lot. If you're going back and forth from the hospital, bring things home, bring things to the hospital, get well cards, little treats, trinkets, things back and forth, so that there's still some kind of connection and some back and forth between the hospitalized child and the home.
Thank you. And here's one from Facebook. How do you help them deal with 100 IV jabs? It's always the worst and nothing seems to help.
Ugh, yes, I know. So I think for this, it's something I preached a lot tonight. It's giving that control. It's giving that choice, right? 100 IV jabs, the 100th most of the time is not much easier than the first, but we can make it more comfortable, right? So we can give them a choice for what pain management they want during that 100th IV jab, whether it is buzzy or whether it's a pharmacological pain management. If your hospital or your center has one, you can ask about those options. Whether it's doing a comfort hold and sitting with you on the bed, sitting with you on the table, whether it's involving some sort of distraction, watching their favorite show, listening to their favorite music, so that they can be comforted during a time of pain. And then making a plan for something fun to do afterwards. If we get through this hard moment, because it is a hard, difficult moment, we want to validate that. What do you want to do afterwards? Do you want to play a game with me? Do you want to watch something that we don't normally get to watch together? Do you want to call grandma at home? What's something that we can look forward to after we get through this difficult moment? I hope that helps.
Thank you. Another question about siblings. Any suggestions on how to deal with siblings? Obviously, they're not experiencing it, but it's still stressful for them. And how can we use siblings to help the situation?
For sure. So they're, healthy siblings of chronically ill kids. That's a whole nother presentation. But I think, they're the forgotten group, right? But we have to support their coping as well. The same things apply to them. We have to be honest and simple and soft with them and let them know what's going on too. Keep them as involved in the care as possible. So when the days return, when they are able to come to the hospital, allowing them to visit, allowing them to come to clinic appointments and be involved in those care conversations, allow them to know what's going on. And then some of my suggestions earlier, helping them stay connected with their brother or sister. So whether that's sending letters back and forth from the hospital, scheduling those FaceTime calls, those phone calls. One fun thing that I've done with some of the patients on my cardiac unit is if they have a brother or sister that they're missing at home a lot, we'll schedule a FaceTime call. And if brother or sister at home has checkers or has Uno or something, we'll actually schedule a board game session via FaceTime so that we can play in the hospital while they're at home and we can do something fun together. So staying connected that way, so that they still get to have that sibling relationship, even though they're separated by the hospital. But there's a lot of really good resources out there too in helping siblings cope with having a hospitalized brother or sister. I don't know if your hospital has it, or if your center has it or not, but a good program to look into is called Beads of Courage. It's something that we do have at Nemours. And it's something that we enroll most of our cardiac families in, but there is a sibling program that goes with Beads of Courage as well. And it's a really great program in getting siblings involved and helping them be recognized throughout their siblings' hospitalization.
Okay, thank you. Peggy, Becca, I'm not seeing anything else.
Through either on our social media or through the Q&A box.
Awesome. Well, I thank everyone for joining us. And if you're watching this after the fact, thank you for tuning in too. Jenna, thank you so much. We can't do it without you. You do an amazing job, and we truly appreciate it. This was a fantastic and comprehensive presentation with a lot of great take-homes. And thanks again to Conquering Congenital Heart Disease for taking on this educational initiative for families and for all of the advocacy that they do for these remarkable kids and their remarkable families on a daily basis. So thank you.
I just want to echo that same sentiment. Thank you both for such a great discussion tonight. It was so much helpful information for preparing children to take part in their CHD care. Thank you to our experts, Dr. Weirden and Jenna, for joining us. A special thank you to Nemours Children's Health for partnering with us to bring this important information to patients and families. For the recording of this CHD Wise episode and all of the information referenced in tonight's presentation, please visit us at conqueringchd.org/learn/CHDWise/. Until next time, good night.
Good night.